Yes, we are live. I want to welcome everybody. Thank you so much for joining us. I'm trying to make this. Okay. So thank you so much for joining us today on our preventive pain medication addiction in sickle cell management. Before our guest speaker join us, I just want to welcome everybody to this webinar and I want to appreciate everybody. So when we talk about pain medication addiction in sickle cell, pain medication addiction in sickle cell is actually a huge problem within the sickle cell community. And it is often because we look at it as something that is not really a problem. You know, there is so much when you see people having sickle cell. We have so much people that have pain medication addiction, and we see what we go through because rehabilitation doesn't really work. Only 20% of people actually get rehab, and this is why we are having this webinar. Our guest is already here, and I'm going to bring him in. Is someone who has experienced addiction before he became a coach, and we are going to be blown away because the first time I listened to him, I was like, what? This is what we actually need in the civil community. We need someone that has experience, and we need someone that can actually tell us about the dangers of dangers of a lot of pain medication that we have used. Join us in welcome, please. If you can hear me loud and clear, kindly let me know in the comment section. Let me know. So I'm bringing in Coach David now. Join us in welcome, please. If you can hear me.
Hello, good afternoon, everybody.
Good afternoon, sir.
Good to be here today. Thank you very, very, very much. Thank you for having me. I hope you can hear me loud and clear.
Yes, we can hear you, sir. Excellent. If you can hear us, please let us know in the comment section. Stay loud. Just drop the comment loud if you can hear us.
Are we getting responses? Are we getting responses? Can we be heard?
Yes, we are getting responses. Loud and clear.
Okay, so can I go on? And I think you have a wrong topic here. It says 5 ways to hydrate well during rainy season.
Okay. Coach will be joining us soon. I don't know what is happening from his end.
I know, I'm here. I was saying that you have 5 ways to hydrate well during rainy season as the topic that is showing here. I think you need to change that so you don't confuse some of our guests. can I just go on? Because of time. Auntie Kemi, can you hear me? Can I go on?
Yes, you can go on, sir.
Okay, thank you. Once again, good afternoon, everybody. Good afternoon to those of us joining us from Nigeria. Good afternoon to those of us joining us from other parts of the country. It's good to have you here today. We're going to be talking about an important topic, a topic that I am very passionate about. And we're going to be talking about a certain group of very special and wonderful people. So it's an intertwined topic, but we're going to do justice to it by the special grace of God. So please, I want you to relax, feel free to take notes, and I'm very sure we're going to have a comment and question and answer time for anybody that has questions that you would like us to answer. My name is David Folaranmi. I am a mental health advocate, a substance abuse prevention, treatment, and recovery practitioner. And I'm going to be speaking to you today in the next few minutes on addiction and pain medication addiction, especially as it has to do with people who live with sickle cell. So first of all, let's take some definition of terms. Let's take some definition of terms. For those of us who might not be familiar with some of the technologies we're using, sickle cell disease is a disease that alters the red blood cells into a sickle cell shape, into a sickle shape. It obstructs the blood flow, causing intense pain, which we know as crisis. I have very good friends who are survivors of this particular condition. These crises vary in severity and frequency, demanding effective pain management strategies. So, like I said, these are a group of beautiful people who are survivors, who are warriors, who are fighters. I mean, some of the things they go through, I'm not sure I can go through it. So it's something that we need to applaud them and we need to support them whenever they are in crisis. Sickle cell disease, otherwise known as SCD, is also a genetic blood disorder. It affects millions of people worldwide. So if you're here today and you are affected by sickle cell disease, I want you to know that you are not alone. It's a genetic blood disorder that affects millions of people worldwide. Of course, predominantly among those from African descent. It's more common on our beautiful continent, Africa. Now, one of the most challenging aspects of managing sickle cell disease is the chronic pain. What does the word chronic mean? We're going to be using this word again in another definition. And by chronic, we mean something that is repetitive in nature. So it comes and goes, and sometimes without any warning sign. So the pain can be there very severe today, and then later in the evening, maybe after the crisis has been appropriately managed by proper medical professionals, you find out that the person who was struggling with that pain is up and about doing her duties again, or his duties. So this chronic pain, that is one of the most challenging aspects of managing SCD. It oftentimes necessitates the use of strong pain medication. The pain is so chronic, and so you need strong pain medication to manage it. Not the regular painkillers or aspirins we use for headaches and body aches and fevers, but stronger medication to manage the pain. However, the use of these medications, particularly opioids, poses a significant risk of addiction. Now, here comes the question. So what do we do? It's a condition that we did not choose to be born into. The pain, this chronic pain, is so excruciating that sometimes it feels like your very soul is coming out of you. I have friends who struggle with sickle cell. Sometimes I hold their hands while they're in hospital and they tell me that the pain is unimaginable. So if the medication, which is supposed to be very strong and special, has the risk of addiction, which is also a disease, do we now leave these very special people to suffer in pain? That's the question. So what we want to do today is to explore or examine strategies to effectively manage pain in sickle cell survivors while minimizing the risk of addiction. That's what we want to do. We want to examine strategies. We want to examine ways or keys that we can use to effectively manage the pain in sickle cell survivors while minimizing the risk of addiction. Because, like I said, addiction in itself is another issue. So we don't want to, in the process of trying to solve one issue, which is a very serious issue, the pain that comes from managing sickle cell, and create another one. So today, basically what we're going to be doing is delving into a critical aspect of sickle cell disease management: pain relief without falling into the trap of addiction. I'll take that again. Pain relief without falling into the trap of addiction. This is a disease that affects millions worldwide, causing unpredictable pain, crisis that can be very, very discomforting. Now, it's important we know that while science, medical science, has provided medications like opioids that are effective in managing this pain, they also come with a significant risk of addiction. So this, by way of introduction, is what we are going to be talking about today: how to manage the crisis and mitigate the risk of struggling with an addiction. Just yesterday, I got a phone call from a friend in the UK, and she was talking to me about one of her nephews who was struggling with sickle cell. Okay, no, not her nephew. A friend's nephew was struggling with sickle cell. And this particular person was a medication, an injection was prescribed to this young man. And he started using it. And very quickly, he became dependent on that medication. He couldn't do without it. So much so that even when he wasn't in crisis, he needed to use the medication to feel alive. That's addiction. By way of definition, addiction is a chronic relapsing brain disease. A chronic relapsing brain disease characterized by the compulsion to engage in a behavior or to consume a substance irrespective of its consequences. So, addiction is not a behavior. Addiction is not a character. Addiction is not a moral failure. So when you see somebody struggling with an addiction to anything at all, don't look at that person as a moral decadent. Don't look at that person as a bad boy or a bad girl. Don't look at that person as someone who has failed in life. You should understand this so you can support and not punish. We need better knowledge for better care. The reason why people are languishing in addiction today, especially in this part of the world, sub-Saharan Africa, is because of the stigma associated with people that struggle with addiction. If you have a son or a daughter or a friend that has malaria, won't you provide medication to treat that person? If you have a friend that has typhoid, won't you provide medical assistance to treat that person? Auntie Kemi, can I continue?
Yes, sir. You can continue, sir.
Okay, so if you have people around you, I came to the office today and two of my clients, one complained of malaria, the second complained of malaria. There was no stigma associated with it. I sent for the medical team to examine them and provide medication for them. That is the same way we should treat people who are struggling with addiction and not stigmatize them. There should be no discrimination whatsoever against people who are struggling with an addiction. No, we must change that narrative. We must bury this myth that people who struggle with an addiction are bad people. No. So I struggled with an addiction for 7 years until Jesus, in his infinite mercy, through the people who provided social support in terms of my family and the medical team, brought me out of addiction. And today I'm helping others, creating prevention strategies, treatment options, and recovery programs to help others come out of addiction. Very quickly, in a few minutes, I would like to share my story of addiction. It's a very long story, but I'll summarize it so we go into the crux of the matter for today. I have not forgotten the story I was telling you about the young child who was given medication for his sickle cell. I'll come back to it. So I was born into a very beautiful, lovely Christian home. I have two younger brothers, and everything my parents did was geared towards raising us up in the way of the Lord. For those of us who are joining us who are Christians, I was born into a Christian home. And my parents ensured that I was always in church. I was always going about my business, doing what was expected of me as a young Christian boy. I learned to read and write very quickly, studying the Bible and teaching to my peers at the age of 8. Now, I'm trying to buttress the point I was making on addiction. So I started off as a young Christian boy, and then before you knew it, I was going to Christian primary schools, Christian secondary schools, and ended up in a Christian university. Now, it was on the grounds of this university that I got exposed to drug abuse. That was my first exposure. So in everything that my parents did in bringing me up, they forgot to teach me about drug use. So imagine a young boy who lived most of his life doing church activities, church programs, now being exposed to drug use and witnessing firsthand the effects it has on a person. I was taken aback, to say the least. But I said, no, I can't do what these people are doing. So I went to my hostel on that fateful day in December of 2003. I got back to my hostel and I started thinking about what I had seen and how those people were acting. And I resolved within myself that I wasn't going to be a part of it. In 2007, I finished from Covenant University. Shortly after, I went to the UK for my master's, and I was living with two Europeans who were using drugs too. Just like I was saying at another program today, it was as if I had moved from frying pan to fire. It became so excruciating. There was always the pressure to indulge in what they were doing. And it was an everyday sort of pressure. wave after wave after wave of peer pressure. Oh, David, would you join us? Oh, David, you are a black man from Africa, so you are afraid to use it. Oh, David, you are this. Oh, David, you are that. And then one day I said, let me try what it is that these people are taking. And that was the beginning of 7 years of chronic addiction to drugs. I came back to Nigeria in 2011 of August, and I started using another substance, which was even more addictive, very elusive, and very expensive. So much so that between August of that year and December of that year, I spent in excess of 3 million naira on drugs. Now, that should buttress the point on the compulsive nature of addiction. I didn't want to do it anymore, but I found myself not being able to stop. In Romans chapter 7, verse 19, Apostle Paul speaking, he said, the good things that I want to do, I find out that I cannot do it. But the evil, which I have told myself that I will not do, I find myself continually doing it. That is addiction. So was I happy that I was spending all that money on drugs? No. But I had gotten to a point where it was no longer a choice for me. It was now a compulsion, a disease of the mind. I sold everything I had. The house that was rented for me, beautifully furnished. I sold my car. I started lying to people that my parents were sick so I can take money from them to buy drugs. And I did this until the point that I had no money anymore. I called my landlord in Abuja at the time and I said, I wanted to leave your house. I want the balance of my money. He gave me 750,000 naira in cash, and I was taken to a trap house, a bunk where people use drugs. And then when I got there, on the morning of that February in 2012, all I could see were young people and old people literally walking like zombies, just walking like that. Everybody intoxicated by the highness from the drugs. They lived in that place. They couldn't go out of that place. This place was a dirty place, a filthy place, an ugly place, a place where all manner of criminals resided. Yet people from good homes, people who had gone to good schools, people who had university degrees, all stayed there. We were all bound by the common denominator, which was addiction. Like I tell people, that place did not have a gate. It did not even have a door. Yet people could not walk out of the place because their minds were in the chains of addiction. There were shackles on their lives. There were chains on their lives. These shackles and chains were not on their hands or their feet, but on their minds. They wanted to come out. Some of them were crying. Some did not have good clothes on. Some of them were sick. Some of them had injuries that needed urgent treatment. Yet they could not leave that place because they were addicted to drugs and they wanted to be close to the source, because that's where the person selling it stays. They wanted to be close to the source of the drugs. Addiction. In 4 days, I had spent 750,000 naira and I had nowhere to go because I had collected the rent from my house. I sold everything. I sold my car. I'd lied to all my friends with bogus stories to collect money from them. So I literally had nowhere to go. So I started living there. The first thing I remember was the story of a 17-year-old girl who was pregnant. She was pregnant because she had started using drugs. When she didn't have money, she had to sleep around and she got pregnant. Now she was about to give birth. Nobody was there to help her. Eventually, some women in the community who served as midwives in the local primary health care center came to help her deliver that baby. She had a beautiful baby boy. I remember I carried that boy and I wondered how such a miracle could be born in such a dirty place. And she started taking care of the child, but the addiction was still ravishing her. The addiction still made her want to look for drugs. But because she was still weak from giving birth, with no proper medication, with no proper feeding, with no proper care, this was a child of 17 years old. She could not make any money to buy the drugs. 2 weeks after that, when the child was 2 weeks old, I sat right next to her in the bunk, and one of the dealers said to her, if you know you need drugs so much, why don't you sell your baby to us? Apparently, they had noticed her the compulsion, that need to satisfy the urge of the drugs, and they knew she didn't have any money and she couldn't go out to hustle. So they had planned already with some people who were going to buy the child. And when they asked her, I could see a look of defeat on her face. And she said, yes, she was going to sell that baby. She sold that baby. She sold that baby boy. And she gave it, same in sickle cell, they lie. Okay, same in sickle cell, they lie about being in crisis to finance their addiction. Yes, yes, I'll come to that. I'll talk a bit about that. So she sold that baby boy and she was paid money and paid drugs, and that's what happened. Now, I lived that sort of life for about 7 years. In that period, I lost 4 of my friends. In that period, I broke my leg that was going to cause a near amputation. This happened like that, went to rehab and back and relapsed. Such was the level of the addiction that I was dealing with. I could not live without those drugs anymore. Eventually, I was able to come out of it. I submitted myself for treatment to a doctor who is late now, and we went through several therapeutic sessions, including cognitive behavioral therapy, motivational interviews, and he puts me through relapse prevention techniques. And of course, I can't share my testimony without saying it proudly and boldly that Jesus played the major role in saving me from addiction and bringing me out. However, there was still the role played by medical sciences. And then after that, I started our organization that is into prevention of drug use and, like I said, treatment and recovery of substance use disorder patients. So when I talk about addiction, I'm not talking of just out of a point of somebody who has studied it. I'm talking out of experience, my own experience and the experience of others. I can tell you firsthand what addiction can do to a person when that compulsion drives somebody to the extent which he can do anything to fuel an addiction. I've seen somebody, I was telling somebody in my office just today, earlier today, that a young girl back in the days dropped her son as collateral for drugs. I've seen somebody that sold the family house with the grandparents inside for drugs. Recently, somebody came to my office and was telling me about his younger brother in Abuja who spent 40 million naira in 1 month on drugs and drug-related activities. That's what addiction can do. Those are some extreme cases of what addiction can do. A chronic relapsing brain disease characterized by the compulsion to engage in a behavior or consume a substance irrespective of its harmful consequences. Now, the story I was telling you about the young boy who was struggling with sickle cell, I say was because he's late now. He started injecting himself repeatedly until he died. Right? Now, when he died, when they were going to wash him, he's a Muslim. When they were going to wash him, it was at that point that they found out that he was injecting the veins in his penis. He was injecting the veins in his penis because the parents knew that they had to look out for sores on his legs or his thighs or his arms. So he wasn't probably allowed to wear things that will cover those parts of his body. That's what the parents were trying to do to restrict him from using those injectables. But when that addiction comes, it makes a person to start thinking of ideas that people will not think of normally. And this young boy was injecting himself on his penis. It was until when they wanted to bury him and they were washing him that they found out that this was what he was doing. And when she told me the story, my heart bled. My heart reached out to that young boy. I wish I was with him when he was going through it so I could give him a hug and say, look, I know you're in pain. You're in excruciating pain, but I'm here to tell you that I have gone through addiction before, and this is not the way to help yourself. Another man called me last year telling me about his 14-year-old daughter who was struggling with an addiction in Jos in school, and she had now become addicted to this same medication. Please permit me, I'm not calling any names of the medication Those of us who are warriors here might know what I'm talking about, but I don't want to expose other people that don't know these things to it because of curiosity. So that because some people now will decide to go and say, let me try what Mr. David is saying. That's the reason why I'm choosing very carefully my words and not to mention some of the names of these things. So this young 14-year-old girl started injecting herself. And the man called me and said, sir, I don't know what to do. And it was so painful for a father. I have friends who struggle with sickle cell, and I can see the pain in their parents. Some of them want to take their place. And I asked this man, how is your daughter getting the money to buy these things? He said, David, I have to send her money because she says that it relieves her of the pain. I said, sir, no, you can't do that. There were tears in his voice. He said, then how would I leave my 14-year-old daughter to struggle in the pain? I said, yes, I know you love her. I know you want the best for her, but we must look for alternative means, because if at that age she's struggling with this addiction already, you can't be fueling it. That is not love. That is destruction. You continue on this path, then you should be equally be ready to buy her coffin and pay for a funeral. Yes, I'm empathic to the pain and the struggle she's going through, but this is not the way. In the last administration, we had to engage the Ministry of Health with the State Minister of Health at the time. And we said, why can't we get alternatives for some of this medication that are addictive for people struggling with sickle cell? And we were making some level of progress, of course, but because of the way things happen in Nigeria, we had to pause that, and then a new administration came in, and we couldn't continue with that. But as God lives, and by the grace of God, we'll pick up from where we stopped, because these are a group of special people. They were predisposed to this illness. They didn't choose it. So we can't make life worse for them by providing what will create another problem when they're trying to solve one. No, something has to be done about it. The government and other relevant stakeholders need to come to the table and sit down and say, look, there must be a way. We need to invest. How much money is attributed to healthcare in the budget? Now, inside that budget for healthcare, what is the percentage for sickle cell warriors? Are we just going to leave them alone to continue using addictive medication that makes their life more miserable? So we have to come to the table and we have to have that discussion. So I talked to the man and I said, no, we cannot continue to fuel that cycle of addiction that she's currently struggling with, because it's going to make matters worse for her. And he agreed with me, and then we started going through a series of other processes to help the girl, and she's getting better now. Now, we're not oblivious to the fact that we have the challenges in pain management. For instance, opioid use. Opioids are frequently used to manage acute and chronic pain in sickle cell disorder, and of course other sort of injuries or pains, due to their effectiveness. However, prolonged use can lead to tolerance, dependence, and addiction. What is tolerance? Tolerance is the state where your body gets used to that medication, that the actual dose you need does not function anymore in treating that pain. So it's tolerance. So for instance, you need 1 ampule of a particular injection to help you through a crisis. You have another crisis next week, you use that same ampule. Another crisis next month, you use that same ampule. At a point, you find out that that is not enough to see you through that crisis or that pain. And what now happens? You need more of it. That's where the cycle of addiction kicks off. So that little ampule does not serve the purpose that it was intended for, because you have developed a tolerance for it. And then dependence. By dependence, your mind is now conditioned to think, to feel, to act that in a way that dictates that you cannot live a regular or a normal life without using that medication. So now you're getting dependent on it. So I had a friend who is a nurse in Kaduna State. She was dependent and addicted to one of these medications, to the point that she is now a double amputee because of injecting both her legs. This is a medical practitioner who you will think knows the effects and the consequences and the repercussions of what she was doing more than you and I. Yet she was not able to stop, even when the leg had been eaten up deeply and badly. On the day of her surgery, when she was asked if she wanted something else, she said she wanted an opportunity to take another shot of that particular injection. That's addiction. That's dependence. Now, before this happened, she would tell me, she would say, David, I can't eat food if I don't use this injection. I can't go to toilet anymore if I don't use this injection. I can't sleep through the night if I don't use this injection. She had become dependent on that medication for her to live a fairly decent life. Today, she is a double amputee. For young people who are struggling with sickle cell, it makes it even worse for addictive medications to be prescribed to them. Why? There's a part of the brain called the frontal lobe, which does not develop till the age of probably 21. That part of the brain that is responsible for decision making, executive functions, impulse control, and sometimes emotions is not fully developed, which is why it is excusable when you see young persons who make wrong decisions. However, when a person starts abusing these substances, that part of the brain, just right here in the front, which is not developed till you're about 21, is now developing with instructions from that addictive medication. So when the person transits into being a young adult at the age of 21, 22, 23, and that part is fully developed, it can't function anymore or appropriately without instructions from substances. So you see where the addiction comes in. It's like molding, using clay to mold that part of the brain. And you have a particular ingredient that you're using. When that clay is fully molded, it can't be broken. So now imagine when that part of the brain is fully molded, for the rest part of your life, you are struggling with impulsive decision making. You are struggling with executive functions and other issues that that part of the brain controls. Why? Because it needs instruction from that addictive substance you are using before it was formed for it to function now. And that is why we have 40, 41, 42-year-olds who are struggling with addiction, and they can't even make a decision on what to eat or what to wear or what church to go to. Why? Because they started using at a young age. And now that we're trying to stop it, and we're because there's no drug to prompt that frontal lobe. So what happens to young persons who are struggling, who are warriors of sickle cell? How do we treat them without using medication that is addictive? Part of the challenges in pain management is stigma and misunderstanding. these beautiful and strong warriors with sickle cell disorder often face stigma and skepticism when seeking pain relief, leading to undertreatment or inadequate pain management. Somebody said something that it's possible that even people who are struggling with sickle cell tell lies to get money from people so they can use to fund their addiction. Yes, this happens. However, we are not supposed to have that mentality because already that is stigmatizing. That is stigmatizing. So, what are the strategies for preventing addiction in warriors who struggle with SCD? What are the strategies for preventing addiction in warriors who struggle with SCDs? Number one, we must engage in multimodal pain management. Please, we need to use, I know they are scarce, and that's why I said this at the highest levels. From the presidency, attention should be drawn to this challenge. We need more people who are speaking up like Auntie Kemi for people who are struggling with SCD. I have friends who go through pain in crisis, and it feels like nobody is paying attention to them. So the government, I'm not talking of local government or state government, I mean at the federal level, needs to pay attention to this. For instance, what I'm talking about now, non-opioid analgesics are scarce. They are scarce and they are expensive. So it's important that we utilize non-opioid medications to manage pain whenever possible. These things should be made readily available for free. Somebody who has access to President Bola Ahmed Tinubu should let him know, or his Minister of Health know, that this medication should be made available for free for warriors who are struggling with SCDs. Because we don't want to use the ones on the shelves that are addictive. And when they use it, we create a bigger problem for these people. We can't continue like this. This is 2024. Somebody needs to speak up and something needs to be done. So number one, please, we should use, when available, non-opioid analgesics. I'll give you a story. I like to teach with stories because I feel it is relatable. So a few weeks ago, I had a broken tooth. Now that tooth, my number 7 on this side, the lower part, has been giving me problem. My darling mother-in-law was around and my wife, and I broke that tooth at home. And so, in fact, I traveled down to Abuja. I was to travel the next day to Abuja. I tried to schedule a dental appointment, but you know how it can be with dentists. Book, you have to book. So I came back to Enugu, and I was eventually able to get an appointment. And my idea of that appointment was to go and just pull it out. On getting there, my doctor, who is a seasoned dentist, said, "Oh, sir, why do we have to pull out your tooth? Why don't we do a root canal treatment?" So I sit down because I'm the kind of person that whatever you want to do to me medically, I must get some knowledge about it. So I'm reading on root canal treatment, something I know about, but not in detail. So I take my phone and I'm reading on root canal treatment. So as I'm reading, he's explaining it to me, explaining the process to me. And I'm like, okay. And he says, look, you're going to experience the most excruciating pain. However, we can give you XYZ. He told me a type of analgesic. However, I knew that these analgesics contain stimulants like cocaine. And as a recovering addict, I said to myself, I will not make the mistake of trying to numb the pain of that tooth by using a painkiller that contains, no matter how little the fraction of cocaine. So I said to him, sir, can we do this RTC without using analgesic? He said that will be the most painful experience of your life. It will be more painful than labor. And trust me, labor is painful. You ask me how I know, I'll tell you I've been with my wife on 3 occasions when she gave birth. So labor is painful, and he said it will be more painful. But I said to myself, don't we have alternatives? And my doctor said, not that there are no alternatives, but we don't have them readily available. This is what we have. I said, okay, so that means I will go in for the RTC without using those analgesics. And trust me, that was the most painful experience I have had in my life. You will literally feel your soul leave your body, and then after some time come back. You will pass out and come back. That's how painful it was. But I did not want an injection in my tooth or my gum that contained substances that are addictive in nature. Now, not everybody will have that level of bravery that you will tell somebody struggling with SCD to ignore the pain because the medication available contains opioids. No. What we need to do is the government, through the Ministry of Health, to come up with more with alternative medications that do not contain opioids. Number two, okay, also under number 1, we can engage in physical therapy. Incorporate physical therapy and rehabilitation to improve mobility, reduce pain, and enhance overall quality of life. We'll keep praying to God for the level of our healthcare system in the country to increase and to progress. But sometimes physical therapy is missing in treatment or management of people who struggle with SCDs, especially at the government hospital levels. It's not available. I mean, for those who are privileged to have money to go to expensive private hospitals, yes, they have access to this type of care. But what happens to those of us who don't have the money or cannot afford the private hospitals? So number 2 is patient education and support. Pain management plans. That's under number 2, patient education and support. Now, you must develop individualized pain management plans in collaboration with the patients, the caregivers, and the healthcare providers to establish clear guidelines for medication to use. Patient education support. Now, listen, we have gone past the stage of a blanket approach to treatment. So if 5 warriors struggling with SCD come in for treatment, the medical practitioner must examine them individually and come up with an individualized treatment plan tailored to the specific need of the individuals. So you can't Mr. A, Mr. B, Mr. C, Mr. D, Mr. E all come into the clinic for crisis management, and you already have a tabulated format to treat them. No, we have gone past that. We can't keep using outdated methods of treatment. These are people's lives. These are people who are already struggling with pain. So what Mr. A needs is different from what Mr. B needs. It must be individualized. It must be tailored specifically to the needs of each individual. Education programs, very important. Provide comprehensive education on pain management strategies, the risks of use of this medication, and signs of addiction to both patients and families. Look, we have a big challenge in this country called Nigeria, where a patient will walk into a hospital and a doctor who spent years in university, in medical school, he did his housemanship, is now working, will prescribe medication that is addictive without educating. Oh, Jesus. This is painful to even talk about. Without educating the people who you are giving that medication to. That's wickedness. Your license should be taken from you if you don't do this. You must expose your patients or your clients to the risks of these medications. We have what we call family psychoeducation. You must educate not just the clients or the patients or the warriors, but their families also, particularly to look out for signs of addiction. You must look out for signs of addiction because sometimes it starts very subtly. And if this education was provided at the center, it would have been nipped in the bud before it blows out of proportion. The next is psychosocial support. Psychosocial support. Every person struggling with SCD must have free, as far as I'm concerned, free access to evidence-based therapy, counseling. We must offer counseling services and psychological support to help the warriors cope with chronic pain, anxiety, depression without solely relying on medication. So sometimes when these crises are about to begin, we have the option of counseling and psychological support. Now, because it's not just the pain, physical pain that they are going through, they go through anxiety, they go through depression. This medication you give them for general anxiety disorder or clinical depression is also addictive in nature. So it doesn't always have to be medication. Talk therapy, psychotherapy, psychological support, counseling, very important. And then for those of us in this community, the addiction professionals, or for the warriors who are struggling with this condition, we should create support groups. Very important. We should create support groups, support systems. We should also encourage each other to participate in these support groups. In every community, there should be a support group for people struggling with SCD. Now, the reason for this is that we want to foster peer support and share experiences, which is known to help with issues like this, in line with world best practices. So please, you also need a level of professionalism to start up a support group. You must understand how it works, and you must bring in people who also understand how it works and want to be there. Now we'll go into regular monitoring and adjustments. There must be monitoring programs. We must implement regular monitoring of medication use, pain levels. Again, I'm talking about signs of addiction through frequent follow-ups and assessments. So there must be regular monitoring. We need to know what pain levels are required for what dose of medication. There must be monitoring. We must learn to adjust. So if I'm using 2 ampules of a particular medication for this level of pain, after a month, we need to assess what level of pain that warrior is going through before we know if they still use that same amount of the medication. Because if there is a significant reduction in the pain, then there should also be a significant reduction in the dose of medication. What about pain diaries? Do we encourage our patients to maintain pain diaries, to track the pain patterns, triggers, and the effectiveness of treatment? These are also very important. These are also very important. So I think I've spoken for about 50 minutes. While I would like to continue, I would like to give a little break here for feedback, either from our host, Auntie Kemi, or from other persons who might have questions that they'd like us to answer. Thank you very much. Is Auntie Kemi there?
Yes, I'm here, sir. Thank you
So
so much,
yes,
sir,
you're
for,
welcome. Thank
for
you.
I'm here, sir. Thank you so much, sir. And I've been enjoying every aspect of the lecture, and I'm very, very sure that our guests have been enjoying it. Please, if you have questions, you can always ask questions. And Coach has actually done a very wonderful job. And in sickle cell, for me, I focus more on prevention. That is one of the things I do as a sickle cell advocate, because I feel like a lot of us focus more on treatment. So when we talk about sickle cell, we have to look for options. Don't allow the pain to happen. So we focus more on the options of prevention, dehydration, good food, other ways to ensure that they have, because if, as long as, like I tell parents, as long as that pain occur, the pain has to be treated. It is an excruciating pain that you can't, it's more than labor pain. I've been through labor and I can tell you that it's more painful than labor pain. So it is very, very important for us to focus more on the prevention side. So please, if you have questions, kindly drop your questions on the comment section and I will be picking it up so that we can see it, and then our guest speaker can actually attend to it. Thank you so much that you have actually explained everything, and I'm very sure everybody enjoy it the same way I enjoy it. If you enjoy it, please kindly drop an emoji to support Coach David. If you have enjoyed this class, if you have enjoyed it as much as I've enjoyed it, kindly drop a comment to let us describe how much you have enjoyed this class. Are you here, sir? Thank you so much. Inena Folaranmi. I hope I got that pronunciation correct. Thank you so much. Okay, I've been seeing a lot of emojis. Thank you so much. Thank you so much. So please, if you have questions, kindly drop your questions so that Coach can take those questions and then we can finish as much as possible. Thank you so much, and I'm happy.
Sorry, did you say something for me?
Thank you, sir. So I've just been appreciating you and everything that you have said to us.
Oh, thank you very much. Thank you. I had a great time. And then I love your smile. It's very bright. It makes everywhere beautiful and very bright. Thank you. So do we have any questions? Do we have any questions? Like Auntie Kemi was saying, it's also important that we pay attention to prevention. You know, there's nothing like as good as prevention. The International Day Against Drug Abuse and Illicit Trafficking, which was commemorated on Wednesday, which just passed, 26th of June, 2024, the theme was the evidence is clear, invest in prevention. Thank you, Vista Image Movies. My very first session engaging this topic that totally makes sense. Thank you very much. We really appreciate it. So the theme was the evidence is clear, invest in prevention. I appreciate you so much, Coach David. Very clear and educative. Thank you very much. That's my mom. Thank you very much. God bless you, ma'am. So we must invest in prevention. Prevention is key. We shouldn't wait to try to solve the problem. We should nip it in the bud by preventing it. And in this case, for the warriors, it's also important that as much as we can, we prevent getting sucked into that addictive cycle. We stop getting sucked into that addictive cycle by engaging in other methods. I know it's painful. I mean, I can't explain it because I'm not there. But like I said, I've seen friends. I've been in the hospital when they go through their crisis, and I can tell you that it's excruciating pain. But yeah, we should just make sure we don't create a bigger problem out of the problem we're in already by making sure that we prevent it from happening. Thank you. Please, how can one fight addiction? I am currently struggling to overcome it. I want to believe that's what you said. Thank you for being vulnerable and thank you for speaking out. That's what you're doing is the first way to fight it. What you are doing is the first way by speaking up against it. Speaking up about it. So when you acknowledge, number one, you acknowledge, you admit, you accept that you have a challenge, which is what you're doing. The 3 A's: acknowledge, admit, accept that you have a challenge and it's making your life unbearable. You're struggling. Then you have started the process of getting better. Number 2, you must admit to yourself also that you can't do it on your own. So don't try to hide it because addiction thrives in secrecy. I'll take that again for those of us that are writing. Addiction thrives, it succeeds, it grows, it blossoms in secrecy. Anything you are addicted to, if you want to come out of it, speak out, talk. You must cry out to get out. You must cry out to get out. Don't cover it. Don't keep buying into the lie that you can come out of it on your own because you can't. So that's number 2. Number 3, be determined. Make up your mind that you are going to get help and do whatever it is that will get you out of it. Number 1, you admit, you acknowledge, you accept. Number 2, you speak out, you cry out about it, and number 3, you make up your mind. You make a conscious decision that, look, this thing, I'm going to do whatever it takes to get help. Because once you're struggling with an addiction, it's an uphill battle, but it is surmountable. The mountain of addiction is surmountable once you've made up your mind to follow through the process. Number 4, seek help from relevant professionals. Seek help from relevant professionals. Medically, very important. Seek help. Mentally, speak to a psychiatrist or a psychologist. Then spiritually, let's not forget the place of prayer. It is very important. Also ask God, oh God, help me out of this addiction. It's very important. I did all 3. I'm also asking you to do all 3. Seek help. Seek help. Be determined about seeking help. Number 4, I think, is it 4 or 5? 4. I've just lost my line of thought. Okay, number 4, because I'm not reading this from anywhere. I'm just speaking. You must replace the addictive habits with positive habits, positive lifestyles. So let me explain to you in 1 minute the science of addiction. When we're talking, we talked about tolerance. So when you start using a substance or engaging in a behavior that is addictive, when you take 1 unit of that substance or engage in 1 unit of that behavior, you build up a little bit of tolerance. Now, what is happening is that your brain secretes what we know is the happy chemical, the reward system of the brain, secretes dopamine. So when you use that drug or engage in that behavior, whatever it is, dopamine is secreted. So what happens is that you want more dopamine. Let's use alcohol, for instance. You drink a glass of alcohol today. Let's assume it secretes half a drop of dopamine. You're excited. When you drink that half cup again, that half drop of dopamine does not excite you so much. So now you believe that you need to drink 1 whole bottle. Then yes, you now feel like, okay, there's more dopamine. Then you want 2 bottles. Oh, there's more dopamine. Then when you drink 2 bottles again, you don't feel that happiness again. Why? Tolerance has built up. And that's how you find yourself drinking 5, 10, 15 bottles until you find yourself in the gutter on your way home. What you are after is not the alcohol. Alcohol is not sweet. It's not sweet. So why do people sit down and keep drinking? So that is why? Because it's not the alcohol they're after, it's that dopamine that is being secreted. So in replacing addictive behaviors with other positive behaviors that still secretes that dopamine, does that make sense? So instead of drinking, try jogging. Instead of smoking, try going to the gym to take care of yourself. Try singing. Try doing things that will excite you, that are not harmful. Try and cook. Make a decent meal. Take your wife out. Take your husband out. Take your children out. Go to the playground. Eat very good food. We teach them to eat well in our treatment facility because I do it. Those of you that follow my status, if you go there now, you see very nice meals. Why? Because it's giving me the dopamine that I need. So I'm getting my highness off those meals. Somebody say hallelujah. So you don't need to continue the addictive cycle. Now, for the person that asked this question, of course, this is just a crash course I'm giving you. You still need to sit down and speak to somebody. I congratulate you for speaking up. Many people don't speak out, but the fact that you have spoken out this morning shows that you are serious about coming out of it. And I pray for you this day that every bondage of addiction you found yourself in, you'll be able to come out of it. Yes, then also we must build, we must establish boundaries. You must have boundaries. So whatever you are addicted to, you must create a wall that blocks you from getting into it. Those are boundaries. You don't need to go to a beer parlor to watch football. You're not the first person to be a Manchester United fan. If there's no light in your house and you know that you're an alcohol addict, then sit at home. Whether you go to watch that match or not, Man U will still lose. So why do you have to go to the beer parlor and then you now get angry and you now drink and find yourself in the same situation? So create boundaries. Somebody says, medically, my location does not afford us the opportunity to speak up. The stigmatization and pity rather than empathy. It's unfortunate. I understand what you're saying. It's unfortunate, and I know some people are not just built the way I am built. Because for me, you cannot stigmatize me. Because before you tell me that I used to use drugs, I'll tell you part of my story that you don't even know. So I wear my own like a badge anywhere I go. Yes, I used to use drugs. Before you tell me, I've told you. So my wife is on this call. Before we got married, I told her. So for anybody that is willing to listen, it's very okay that they know that I'm using drugs. Can a warrior's caregiver keep pain diaries? If yes, please. Very important. That's very excellent. I actually did have this on my notes. In family psychoeducation, we must teach the caregiver of a warrior how to keep pain diaries when the warrior is still young. Even when they are not young, sometimes when they are in crisis, you are the one that is supposed to fill in those diaries, and that's it. So yes, you are very correct. You can. Thank you for that that observation. Thank you very much. So I think I've given you 5 points. Like I said, coming out of addiction is not a crash course, but with these few points that I've given to you now, if you can seek more professional help, I'm sure you'll be able to come out of it, especially if you're determined to. Any other questions? Auntie Kemi, any other questions?
Yes, sir.
Do we have any other questions?
No. Do we have any other questions? I think we have answered all the questions. So I want to say thank you so much. It has been one half plus that is very full of resources. Like we learned so much. Thank you so much for sharing your story with us. Thank you so much for teaching us on the depth of your heart. And thank you so much for bringing it. When I saw the comment of someone, I said, this is, let me read the comment again. It's a thanks for putting this together. My first session engaging this topic that totally makes sense. You know, we keep talking about addiction. We keep talking it from a place of blame. You know, it's a very common thing where we blame the people, because parents don't understand it takes a lot of willpower to manage pain. It doesn't take a lot of willpower to actually overcome addiction. And as somebody who has seen a lot of people living with sickle cell addicted, and the first time we keep getting from parents, because most times when I see my patient, when I see them going back, when I see my warriors going back to addiction, when they relapse, it's always painful for me. And first thing we always look at is that it's coming from the place of home, where the parent kept blaming the child, where they kept making everything about the child. See, when a child is in addiction, it has happened, we always look for solution together, so we don't have to keep using that as a point of abuse. You better, if you have pain now, we have a way of making it to poke them every time, and that is actually not helping. So I want to appreciate you once again, sir. Thank you so much. Please, everybody, drop a message. Let us clap for Coach David. Somebody has a question. Is it possible to get to speak with you after now? I will drop it. And another thing is that we are working on a course. It's going to be a course to help people with addiction, because a lot of people with sickle cell are relapsing, and we are bringing it. So for David and Ignite Sickle Cell Initiative, will be working together to create a crash course, and this course is going to support people that are dealing with addiction. So we are going to come up with a date where we come up with this announcement. We explain to people, and we let you know how we are going to, people can register for that course. So I'm going to bring a coach on so that he can talk more on that topic, on that course. So let me bring him.
Thank you very much. So we're going to have the course, and Kemi and myself are going to put up a course together. First of all, we want to be able to educate you on evidence-based prevention strategies that are in line with world best practices. Very important, because we want to be able to prevent it. But then also in that course, we're going to be talking about causes of addiction, risk factors of addiction, the trends of addiction, different types of addiction, even as it relates to warriors who are struggling with sickle cell. So it's not just the addiction to the pain medication. There are other types of addictions that they can struggle with. So it's going to be a very robust course. And like they say, sometimes if you think knowledge is expensive, try paying for ignorance, and you know that knowledge is not expensive. So I'm very sure it's going to be something that is affordable. We are not doing this to milk you. We are doing this to provide you with information and tools that will help you. The government is not ready to help us. I mean, they can't be bothered when their own children are struggling, they fly them abroad. So why don't we harness on what we have? You know, why don't we make the most of what we have and see that we live fruitful and positive lives? Thank you very much. Once the details of the course has come out, it will be passed across through all the various platforms. Thank you very much for having me. I wish us all a beautiful weekend. God bless you, and I love you. Bye for now.
Amen. Thank you so much, sir. Thank you so much. Thank you for joining this live. I really appreciate everyone, and thank you. This is going to be the end of the class, and we are going to reach out to everybody about the course, because we want to keep helping other people, because there is always one side of pain recovery when it comes to rehab that people focus on. But in sickle cell, it is more complicated, because we have so much people that after that addiction, they are still getting in pain. They are still in pain. They still go to the hospital. They still give them the same medication that led them to addiction. And before you know it, they are back to square one. So we are looking for a very good way. It's going to be very, very affordable. And we're going to reach out to everybody. So thank you so much. And I appreciate it. Oh, thank you, Fatima. I didn't regret joining this session. Thank you so much. God bless you all. And bye. The replay will be available, please.